The Centers for Medicare and Medicaid Services Center for Clinical Standards and Quality brings you CMS QI Voices. As part of this series, CMS is hosting several special episodes to provide nursing homes with the facts needed to discuss care plans with residents and families in order to improve resident outcomes related to the COVID-19 virus. In conversations with the CMS Chief Medical Officer, nursing home leaders will hear about the latest information on COVID-19 vaccines and therapeutics from CDC and FDA experts. Let's listen in.
Welcome again. I'm Lee Fleischer, the Chief Medical Officer for the Centers for Medicare and Medicaid Services. The purpose of today's series is really to give you information about the interventions that you can make both to prevent COVID-19 in the residents in nursing homes, as well as the staff, of course, but importantly, the treatment of COVID-19 for those residents. Today, we have two incredible leaders from the Centers for Disease Control and Prevention, Dr. Namali Stone and Dr. Arjun Srinivasan, both from the Division of Healthcare Quality and Promotion. Thank you for joining me today. Dr. Stone, in your role at CDC, you work to address the needs for infection prevention programs, including use of immunizations, especially in long-term care. We are hearing that residents and staff are skeptical about the benefit of the bivalent vaccine. Many people have received one or more previous boosters and gone on to experience COVID-19. What can you share with them to address this concern?
Hi, Dr. Fleischer. Thank you for the invitation to join in this important conversation. Your question touches on a very real and understandable concern among people right now, and not just those living and working in long-term care, but across our communities. They're asking, why should I bother with yet another booster? Or they're thinking, COVID-19 isn't causing serious harm anymore. So why does the vaccine make a difference? Unfortunately, we continue to see in COVID case data tracked by CDC that adults age 65 years and older have the highest risk of COVID-related mortality and experience the greatest proportion of deaths. Of significant concern, as of September of this year, adults over 85 years account for 40% of all COVID-related deaths. And in many communities, respiratory viruses, including SARS-CoV-2, are circulating and causing illnesses. So in long-term care, where we care for the most frail and older adults, the threat of the virus remains significant. But there is good news. A recent CDC report shows that the bivalent vaccine offers significant additional protection from symptomatic infection above receipt of one or more of those monovalent boosters across all age groups. And we're detecting a similar signal of the protective effect from the bivalent vaccine in the resident case data reported into the National Healthcare Safety Network, or NHSN. We hope to get those results, as well as the bivalent vaccine effectiveness evaluations for hospitalizations and deaths, made available as soon as possible. People are appropriately cautious about trying to predict the performance of the vaccine into the future, but consistently, the vaccine effectiveness data demonstrate protection from the boosters.
Do you have other advice for the nursing home leaders to help them talk with staff and residents who are feeling reluctant to accept yet another vaccine?
You know, I suspect that providers across the country are doing everything in their power to provide education and ensure access to the bivalent vaccine for their residents and staff. But as we're going into now our third year of the COVID-19 pandemic, I understand that everyone is tired. They're tired of talking about COVID. They're feeling exhausted by the emotional toll that this experience has taken on their community, on their family, on their peers, and everyone is feeling somewhat frustrated. So our usual strategy of providing pages and pages of educational materials about the vaccine, it's not going to get at the heart of people's concerns. And we need to start approaching these conversations differently in a way that allows someone to express their concerns and their beliefs and to have their feelings and their perspective acknowledged and validated. In nursing homes and other organizations, establishing trust and deep connections among the staff at all levels and through relationships with residents and families seems to be the key to success when we're looking at promotion of the bivalent vaccine and other safety initiatives as well. There are several resources available from the CDC's Vaccinate with Confidence program to help leaders engage in meaningful, honest, and caring conversations about vaccines. In addition, AHCA developed and released a wonderful online free training course to teach the principles on how to build trusting relationships. As with many things, the pandemic has identified points of vulnerability in our healthcare system, but it's also provided us with an opportunity to address these challenges and in the process create stronger, lasting connections among our peers that will increase the quality and safety well beyond the pandemic.
Thank you so much. And thank you for bringing up the issue of the importance of talking to the families too, which is something we're all hearing. Dr. Srinivasan, you have been a national champion on infection prevention for decades. Could you highlight some of the CDC programs and collaborations that are supporting nursing home infection prevention and vaccine promotion efforts?
Yeah, absolutely, Lee. And, so many of these, as you well know, are collaborations between CDC and CMS. And that has been true since the very first day of this pandemic. We've been talking pretty much every day, maybe multiple times a day early in the pandemic, to make sure that we are doing everything that we can possibly do to support nursing homes and all that they need to do. And I think we cannot emphasize or underestimate the toll that this has taken and continues to take on our colleagues who work in nursing homes. The last 3 years have been incredibly challenging. And we know that staff in these homes have done unbelievable work. And I think probably borne a lot of unfair criticism for some of the outcomes that have happened. And that's something that I think we all wish were very different. But I want our colleagues in the nursing home to know that we feel what you have been working on. We know how hard you're working. So some of the things that, we have available that we want nursing homes to take advantage of, some of the support, the state health departments are your partners in all of this work. And so from an infection prevention point of view, if you are in a home and you start to have cases, you're not quite sure if your infection prevention measures are sufficient or strong enough to prevent the spread of COVID within your facility, or even before you have a case, if you just want to know, hey, am I set up? Am I doing the things I need to do in order to protect my residents? The health departments are there. There are experts in infection control in every state health department. They are a resource for you. They can do assessments either on site or remotely, and they've done this a lot. We know that over the past 3 years, our partners in state health departments have done over 58,000 of these consultations, mostly with nursing homes, in order to help them. That resource is available. And there are also resources available if you need help with vaccination, if you need support with your vaccination efforts. There are a lot of resources that are available. We know that most of the nursing homes are using their pharmacy partners, and that's fantastic to administer these vaccines. But if you are having any challenges there are also resources in the state health departments, and there are state immunization programs, again, in every state health department. And many of these immunization programs have stood up strike teams and other types of support services for the healthcare sector, especially for nursing homes. So if you need help and support with infection control or vaccination, we really urge you, reach out to your state health department. And that's just the support that we provide on the CDC and health department side. And Lee, I don't know if you want to say a little bit about the support from the quality improvement networks and organizations, which is yet another resource for nursing homes.
Certainly, our QIOs are there to support you, and this is part of that larger CMS response and outreach to the nursing homes. Thank you. So, Arjun, based on what you've shared about these national efforts, how would you translate them into specific steps a provider could take for assistance promoting or accessing the bivalent vaccine for their nursing home?
Yeah, Lee, as Namali mentioned, there are a number of resources that are available to help with the promotion. Again, we know it's hard. We know people are tired, they're frustrated, they're fed up, honestly, just fed up with it. And there are some tools and resources that are there. They're available from CDC, from the American Healthcare Association. We think those are nice tools to help with the awareness, try to build some degree of enthusiasm, if you will, for getting the bivalent. On the administration side, I think we would encourage people to go follow any path that works for you, right? So if your pharmacy is coming on site and can administer the vaccine, if you've got somebody who wants it, they can help you with that. We are getting ready to increase the ability of nursing homes to give the vaccine on site. We have heard for a long time that this has been a huge challenge, right? We can't store it on site. We can't give it here. So if we have that person who says, I want it, we have to wait for the pharmacy to come back in and bring it. And maybe that's 2 or 3 days. And by that time, we've lost that momentum. Maybe they don't want it anymore. So we are working on some more flexibilities for nursing homes to be able to get the vaccine from a pharmacy partner to store it on site. The vaccine can be stored on site for a period of time. And then that way the nursing home has it on site and their own staff can administer the vaccine at that moment. So when you have the family there who can consent, or you have that resident who says, okay, today I want it now, I'm ready for it, there are resources. You can have it on site and give it. There's going to be more announcements coming about that very shortly. So we really encourage nursing homes to consider that approach. So the pharmacy, giving it on site. And then if both of those are not good options for you, the state is there. Call your state health department if you need support. We just want to emphasize that no one should feel at a loss for a pathway to get vaccine to their residents. If you can overcome whatever reluctance is there, there are so many different pathways that we want you to pursue in order to get the vaccine into the arms of your residents.
Well, thank you both so much for your time today and for the incredible leadership you are each providing to our nation in order to advance safety and health in this age since the beginning of the COVID-19 pandemic, as well during this time period when we are seeing the rise of other respiratory viruses. To our listeners, thank you for joining, but also thank you, as Arjun said, for all you do every day in protecting the residents of nursing homes. And be sure to join us next time to hear how we in the federal government, at least from the CMO conversations and overall how we at CMS are trying to assist you in increasing vaccination rates and reducing, importantly, mortality in our nursing homes.
To learn more about today's episode and to access all of the CMS QI Voices audio series and show notes, please visit qioprogram.org/CMS QI Voices. Thank you for listening to CMS QI Voices.